The next two speakers are Eliane Schreuder and Charelle Bottenheft, and they're Eliane is a cognitive psychologist, I think is the way, and Charelle is a neuropsychologist, and they're going to look at, or have looked at, staff satisfaction levels in elderly care facilities. So you wanted to come up and do your double thing? Great, thanks.
Good afternoon, everybody. Jan, thank you for the introduction. What we want to do in this session is first I want to introduce shortly our organization TNO and explain about the research we do in our apartment. And then we dive into a research on staff satisfaction in nursing homes. TNO is an independent applied research organization in the Netherlands, and it's regulated by public law. So it's not owned by the government or a university or a company. And our mission is that TNO connects people and knowledge to create innovations that boost the sustainable competitiveness, strength of the industry, and the well-being of society. And as such, we do research. You can group the research in 5 main themes, which I put on the slide here. And what the strength of TNO is that we put, to do our research, multidisciplinary teams. So we put researchers together that would normally not work together. For instance, I do research in the healthcare domain, but I work together with researchers who build simulation models for submarines. So in this way, we foster innovation. Our department is called the Dutch Center for Health Assets, and we want to contribute to sustainable, safe, good quality, and affordable healthcare structure nationally and internationally through research, knowledge dissemination, and consultancy. And our expertise is basically focused on 2 areas. On the first hand, it's really about the building itself. So, for example, we do research on high-level planning and development of hospital buildings, but also very specific research on the impact of, for example, the positioning of the operating table in an operating theater on staff efficiency and patient safety, or, for instance, research on the impact of waiting area design in outpatient clinics on stress levels of patients and well-being, but also indoor climate research in nursing homes. On the other hand, we also do research on age-friendly environments and how to keep people out of these health facilities. And today, we're gonna speak about the predictors of staff satisfaction in the built environment in long-term care facility. And this will be done by Charelle. So Charelle, the floor is yours.
Thank you, Eliane, for this introduction. So I would like to tell you more about our study. In order to build or renovate effective healthcare facilities, there's a rising interest in the influence of the building design on the well-being of the users, for example, patients, staff, visitors. And different studies has demonstrated that the physical healthcare environments can affect patients' health and well-being. And by understanding the effects of the physical environment, this will allow us to design healthcare environments that generate potential health and well-being benefits. And a lot of research has been done on the influence of the building on the patients, but the staff are also important users of healthcare facilities. Satisfied staff is very important because research showed that, for instance, job satisfaction has also been shown to mediate the effect of heavy workloads, which affects patients too, as staff stress impacts patients' well-being. So in order to effectively build or renovate healthcare facilities, attention should be paid to both patients and healthcare staff. However, research on healthcare staff is very limited, as Dijkstra and Pieterse concluded in a literature review, there is still insufficient evidence on the impact of the physical environment on work-related outcomes of healthcare staff. And this is why we became interested in the impact of the building on the staff next to the patients. And to gain more understanding of the building environment on user outcomes, there's a rising interest in conducting post-occupancy evaluation studies. I'm going to call it POEs, if that's all right. With a POE study, it is assessed after the building is constructed how well the building performs. And the knowledge gained can feed forward into new building designs. And the ambition of our department is to use the information from POEs and other research to be able to predict the performance of the building based on only design input during the design phase in order to optimize decision taking. Well, so far the general background. Let's talk about the background of our study. For our study, we used data from 3 POE for 3 nursing homes in the Netherlands. And on this slide, you can see the pictures of the 3 nursing homes. 2 of them located mid-part of the Netherlands and 1 of them northern part of the Netherlands, all in urban setting. And they are built between 2006 and 2008. Nursing home Z and nursing home I are small-scale units in a large facility, and nursing home W has individual apartments, including care services. The main aim of this explorative study is determining which design factors of the built environment in these 3 nursing homes contribute the most to staff satisfaction with the building, and to explore whether the hierarchy of predictors differ per building, differ per nursing home, or whether a more generic hierarchy of predictors exists. And if we have this knowledge, it provides insights in the design factors that are most valued by the nursing staff, and it can indicate areas to prioritize in design decisions. Now I want to tell you something about the overall method of this study. We used a questionnaire to evaluate the performance of the building. And with all these questions about the building, we identified components with a factor analysis that represents the evaluation of design factors. And finally, with regression analysis, we investigated which of these design factors contributed the most to staff satisfaction and whether the hierarchy differed per nursing home. And I will explain this in more detail in the next slides. As I mentioned, we conducted 3 POEs. For the 3 buildings, the same questionnaire was used to evaluate the performance of the building. The questionnaire contained a total of 84 questions with 5 demographical items, such as gender, age, function, 67 statements about the evaluation of the building, such as, this is a beautiful building, I have enough privacy, I feel safe, with which the participant could agree or disagree on a 5-point Likert scale, with higher scores reflect a more positive evaluation. And there was 1 outcome measure, which is the overall satisfaction score with the building on a 10-point scale. We included a total of 314 cases, and with cases I mean staff and volunteers, further referred as staff. 35 from building I, 15 from building W, and 264 from building Z. And because the questionnaire contained a lot of questions, we reduced the number of questions and grouped them together into reliable and meaningful components. And this is done with a statistical analysis, the principal component analysis, the PCA. And this analysis groups questions together that have the same underlying theme. And a reliability analysis is then used to check the internal consistency of these groups. And in this study, we extracted a total of 15 design factors with a reliable internal consistency For the researchers, Combach's alpha equal or to or above 0.70. And here you can see the 15 extracted design factors. In the second column, you can see the number of questions belonging to this design factor. And in the third column, an explanation of some of the questions belonging to the design factor. And in the right column, the Combach's alpha. And the 15 design factors are facade design, ambience, indoor climate, view or light, noise, functionality for clients, functionality for staff, building at nighttime, safety, accessibility, facilities, room for activities, orientation, access to the building, and green environment. And for access to the building and green environment, only one question is included, so the Combach's alpha isn't applicable. After the design factors were determined, we investigated which design factor contributed the most to staff satisfaction with regression analysis. And the dependent, or also named as the outcome variable, is the overall staff satisfaction score. And the independent variables are the design factors. And you can see this model on the picture for the 3 buildings. And we used simple regression, but also multiple regression, hierarchical multiple regression. And in a simple regression, you can check for every single factor if there is a significant contribution to staff satisfaction with the building. And only the significant factors were included in the multiple regression. And this last analysis, this last regression shows the hierarchy among the design factors and the unique contribution of the design factors on staff satisfaction. And we also looked at the interaction between the different buildings and the design factors on staff satisfaction. And this investigates if a design factor has the same impact in all the 3 buildings. In that case, there is no interaction. Or if there are design factors that are context dependent, then we find an interaction. And this last means that it has more or less impact on satisfaction in one building compared to another building. The results. As said before, all significant factors of the simple regression are included in the multiple regression. And as you can see, all factors are significant except for green environment. And in the third column, you can see the significant factors that are unique predictors of staff satisfaction and don't differ per building. And these are facade design, ambience, and functionality for staff. And if you look at the standardized betas of these significant factors, the higher this value is, the greater the effect on the dependent variable on staff satisfaction. It appears that facade design is the greatest contributor, followed by functionality for staff and ambience. And no context-dependent effects were found, so no interactions. It should be noted that the other factors have an indirect effect on staff satisfaction via facade design, functionality for staff, and ambience, but have no unique contribution to staff satisfaction. And another note I want to make about the non-significant result of green environment is that probably people don't include green environment explicitly in their evaluation of the building if it's asked, because they don't see it as a part of the building. So we find that the design factor facade design is the greatest contributor to staff satisfaction, followed by functionality for staff and ambience. Facade refers to the outside of the building, such as the architecture, or is it a nice building, has it an inviting entrance, facade colors and beautiful materials, but also if the building fits with the environment. So apparently the looks of the building greatly influence the staff satisfaction with the building. The factor functionality for staff refers to the evaluation of the equipment in the building. Is there enough privacy? Does the building fit for purpose? The staff sanitary? Is it a nice building to live or work in? And is there enough space to meet with colleagues? And the last one, ambience, refers to the inside of the building, the used colors and materials in the building, and the interior design, but also the lights in the building. It's included also if people can regulate the light by themselves and if there are cozy general areas. And the last slides. So these results imply that when staff of nursing homes is asked to rate the building they work in, facade design, functionality for staff, and ambience influence their assessment the strongest. So in order to increase staff satisfaction with the building, this study indicates areas to prioritize in design decisions. And the strength of this study is the integration of the information of these 3 POEs. Often evidence with regard to the effect of the building, of the built environment on its users is based on only one POE, which makes the results context dependent and hard to generalize. And however, a limitation is the small sample size in 2 buildings, which might have impacted the power of our interaction analysis. And interesting further research would be what intervention in the facade, ambience, and functionality achieve an increase in staff satisfaction? What is the relation between satisfaction with the building and overall job satisfaction? And how to create an optimized design for both clients and staff? And by publishing this study, we hope to create a greater awareness among designers and decision makers to build nursing homes that support the satisfaction and well-being of both clients and staff. Thank you.